Marcy was a gifted artist, a piano prodigy, and a wonderful big sister. She taught her sister how to play the easy parts of the piano so that she could do duets together. Marcy taught her sister art, how to make matzo ball soup, and how to build a snowman. But measles ruined all that. In February 1960, Marcy, who was in the fourth grade, contracted measles from a classmate. After several days of being in bed sick with a high fever, a doctor came to do a house call. After checking on her, the doctor said she needed to go to the hospital immediately. The normal quiet of the neighborhood was suddenly broken when an ambulance roared up the street. The EMTs carried Marcy down the stairs and whisked her away into the back of the ambulance and rushed off to the hospital. At the hospital, the doctors did all they could, but offered no hope. The prognosis was grim and got worse when when Marcy slipped into a coma. But sometimes amazing things happen. 5 weeks later, Marcy emerged from the coma, and by late April, she was able to return home. At first, everything appeared to be fine, but it wasn't. Marcy's behavior and personality had changed. She struggled to learn new things, even in classes that she had previously done well in. Her musical ability suffered. While she could still read music, she often made mistakes and was unable to play as dynamically as she could before. She was irritable. She was defiant. Everything escalated to shouting matches and crying. Measles left Marcy physically and psychologically impaired. She struggled with critical thinking skills and mental illness. She was dependent on medication to control her seizures for the rest of her life. At random times, she would respond to situations with an inappropriate and uncontrollable laugh. Marcy died in August of 2020 from complications from COVID-19, 4 months before the vaccine became available. She was very much looking forward to getting that vaccine. Marcy survived her case of measles encephalitis, but it devastated her life, her future, and her family. Marcy's sister, Emmy, writes about her sister's experience and wonders what her sister's life would have been like had it not been for measles. She questions, quote, would she have become a mother, a musician, a scientist? I will never know. But I channel Marcy's fiery spirit every time I write about her or about measles, with the hope that I can persuade parents to vaccinate their children against this insidious disease. End quote. Emmy's message could not be clearer. Vaccinate, vaccinate, vaccinate. Hello, everyone, and welcome. My name is Dr. Jeremy. I am the Everyday Epidemiologist. Today, we are going to be talking about measles. But before we get into that, a couple of quick disclaimers. First, I am not a medical doctor. Nothing in this video is medical advice. Any medical advice you want or need should be obtained from your physician. Second, this information is being brought to you by me alone as someone who knows a bit about public health. It is not coming in any sort of official capacity from the health department where I work. Third, all the information provided in this video comes from publicly accessible websites, books, and research articles. The sources are in the description of the video. Fourth, I try to provide as accurate and scientifically based information as possible. However, I may misspeak or say something that is incorrect unintentionally. If you catch me on this, please leave a comment with what I said wrong, and if possible, a source to the correct information, and I'll look into it. If I was wrong, I will correct myself, either in this video or in a future video. There will be pictures of people with measles throughout the presentation. I will tell you when they will be shown and when they will be taken down. Most of them are fairly mild, but if you're squeamish, you may wish to look away. If I miss one or forget to mention it in time, I'm sorry. I will stop periodically throughout the stream. However, if you have any questions, put them in the comments at any time, in the chat at any time, and I'll answer them as soon as I see them. But let's get into this. What is measles? Throughout this section, there will be pictures of people with measles. Measles is a highly contagious respiratory disease that can result in severe and sometimes permanent complications, including pneumonia, seizures, brain damage, and even death. Measles symptoms appear after an incubation period of typically about 7 to 14 days, but it can be up to 21 days. The early symptoms include high fever, typically more than 104 Fahrenheit or 40 degrees Celsius, a cough, runny nose, red watery eyes, aches and pains, tiredness, loss of appetite, and a rash. Excuse me. This rash typically starts 2 to 3 days after the symptoms begin and appear as spots with white or bluish-white centers and a red base and are located in the mouth, as you can see in the picture. These are called Koplik spots. Between the 3rd and 7th day of the disease, a red blotchy rash appears on the face and spreads to the rest of the body. This rash typically lasts between 4 and 7 days. Other signs include leukopenia, or a decreased white blood cell count, and a decrease in vitamin A. Most people typically recover from measles 7 to 10 days after the symptoms first appear. However, not everyone has it that easy. Numerous complications from measles can occur and are sometimes due to secondary bacterial infections. Some common and relatively minor complications are ear infection and diarrhea. An ear infection occurs in about 10% of children with measles, and diarrhea occurs in about a bit under 10% of measles cases, give or take a little bit. But it doesn't end there. 1 in 5 unvaccinated people will get measles that need to be hospitalized. 1 out of every 20 children infected with measles will get pneumonia, or an infection of the lungs. This is either caused by the measles itself or by a secondary bacterial infection. For every 1,000 children infected with measles, 1 will develop encephalitis, or the swelling of the brain, which is what Marcy had. This can leave the child deaf or with intellectual disability. Worse than all of that, though, between 1 and 3 out of every 1,000 children who become infected with measles will die due to these complications. Even if you aren't a child, you aren't out of the woods. If you have not been vaccinated and become infected while pregnant, this can cause the child to be born prematurely or cause the baby to have a low birth weight. Malnourished children are at risk of additional severe complications, including a hemorrhagic rash, protein-losing enteropathy, dehydration, diarrhea, blindness, and severe skin infections. A couple of quick definitions. Hemorrhagic just means bleeding, and it typically refers to excessive or severe bleeding. Protein-losing enteropathy is where proteins leak into the gastrointestinal tract and lead to low protein levels in the blood, which can be very, very dangerous. Even if you make it through measles without any of these complications and you fully recover, you still aren't out of the woods yet. Between 7 and 10 years after you recover, you could get something called, let's see if I can pronounce this correctly, subacute sclerosing panencephalitis, or SSPE. SSPE is a progressive, disabling, and deadly brain disorder that occurs in about 4 to 11 per 100,000 measles cases. Normally, the measles virus doesn't directly damage the brain, but instead an abnormal immune response leads to the brain inflammation and the damage. Sometimes, however, a variant form of the virus can cause the damage directly. But what does SSPE look like? There are 4 stages of the disease. In stage 1, there may be personality changes, mood swings, or depression. These are often accompanied with fever and a headache. This stage lasts for about 6 months. Stage 2 presents with uncontrollable jerking and muscle spasms. The person may also have a loss of vision, dementia, and seizures. Stage 3, these uncontrollable movements are replaced with writhing or twisting movements and rigidity. People can die from complications in this stage. But most of the deaths come in stage 4, which is where the areas of the brain that regulate breathing, heart rate, and blood pressure become damaged. This leads to coma and to death. Unfortunately, there is no cure for this. People typically die between 1 and 3 years after the symptoms first appear. It can take longer, but nobody survives. And the pictures of the measles symptoms have been taken down, so if you're looking away, you can look back now. But I've gone through quite a bit, so let's take a quick break to see what questions and comments you have at this point about measles. So let's see. Hello again, everyone. Hope everyone's doing well. But let's see. Ren again said that she had a fever that high before. She says, never again, thanks. That's a fever of that high is really nasty, really nasty. Susan says he thought it was more spotty like chickenpox. I thought so too, until I saw the pictures. But it's a bit more diffuse than chickenpox is, even. She also says that's a very high rate of encephalitis. It is. It is. Measles is a nasty, nasty virus. Causes all sorts of nasty things. How many people have died from the SSPE in the past 50 years? That is a good question. I don't know the number for that, but we can estimate at least. So in 2000, we'll get to some of the numbers later, but in 2000, globally, there were about 30 million measles cases in that year alone. And if, say, 5 out of 100,000 get SSPE and die from it, that would be about 150 that died in 2000 alone from it. But I don't have the numbers for that. Let's see if I can find it real quick. That's a good question. Though there are other things that cause SSPE as well, so these numbers might not just be from measles SSPE if I can find them. People dying from SSPE since 1970. Well, here's a source. Let me pull it up. Let's reject all these cookies, because forget cookies. So this article, subacute sclerosing panencephalitis mortality in the U.S. from 1979 to 2016. Let's see what this says. I don't know if this will have the answer or not, but we can see what it says. Okay. Nope. It doesn't say in the abstract, and I don't have access to the full article. Uh, so that is not helpful. Let's see if I can find any more information. Let's see. Um, yeah, I'm not seeing any numbers. No, can't find it. The only thing I'm seeing is the estimate of 4 to 11 out of every 100,000. That's all I can find. Um, how contagious compared to the flu or COVID? We'll get to that shortly. Good question. We will cover that. Susan also says she knows someone who had loss of circulation in fingers and toes due to encephalitis. Yeah, her fingers and toes turned black and had to be amputated. Yeah, encephalitis is not pleasant. It is not a pleasant thing at all. Definitely not something you want. That's for sure. So let's go ahead and continue. Let's get the pictures back up. Oh. That's, oh. There we go. That's the picture I'm looking for. Sorry about flipping through all those. But I hit the wrong button when I was trying to turn it back on. So, what is the causative agent of measles and how is it spread? And during that, we'll also cover how contagious it is. Measles is caused by a virus in the Paramyxoviridae virus family. Diseases caused by different viruses in this family include measles, mumps, parainfluenza or croup, and respiratory syncytial virus or RSV. There have been 24 measles virus types described, but the number of observed virus types through disease surveillance programs has decreased in recent years. In 2016, only 6 were observed, 5 in 2017, and just 4 in 2018 and 2019. Now, this will get to your question, Susan. Measles is one of the most contagious diseases we know about. One person with measles can infect between 16 and 18 non-immune individuals. 9 out of 10 non-immune people exposed to the virus will become infected. And in this picture, you can see how many other people one person will infect for a variety of other diseases. So you can see COVID and flu down at the very opposite end with about 2 to 3 people that they will infect. So very much more contagious than flu or COVID. Much, much more contagious. This virus spreads through the air when infected people cough or sneeze. You don't even have to be in the same room as them when this happens in order to catch the virus. Even if you enter the room up to 2 hours after they left, you can still catch the virus. Not only that, but the virus lives on surfaces for hours. This means that if someone with measles coughs into their hands and touches a doorknob, and you touch it, even hours later, then you touch your nose or mouth, you could catch measles. Or if someone with measles coughs or sneezes in a room without covering their nose or mouth, the little droplets that are filled with measles virus will settle down onto the surfaces, waiting for someone else to come along and touch it. Measles can also be transmitted vertically, as I alluded to earlier, meaning from a pregnant woman to a fetus during pregnancy or to the baby during delivery or while breastfeeding. How do we treat measles? I want to reiterate here that I am not a medical doctor, and what I say should not be taken as medical advice should you or someone you know get measles. If you have measles or suspect you might, talk to your healthcare professional. First of all, there is no cure for measles. The only thing that can really be done is treat the symptoms and wait it out. To do this, you can give pain reducers and fever reduction medications and make sure the person stays hydrated and eats a healthy diet. I see a quick question. What is the chance of survival for a fetus or newborn who gets infected? I didn't see that information. I don't know. We'll save that for the next question break, and I'll see if I can do some research to find it then. But that's a good question. I do not know the answer. So yeah, if secondary bacterial infections occur, and only if secondary bacterial infections occur, antibiotics can be given to treat those. People with measles, particularly those who are malnourished, should also be given 2 doses of vitamin A supplements. This can help prevent the effects of vitamin A deficiency, which can include eye damage and blindness. It can also reduce the mortality from measles. Vitamin A treatment should be managed under the supervision of a healthcare professional due to other potential complications. In more developed countries, which have better medical care and better nutrition, I saw that there may be less benefit to providing vitamin A supplements, but it's still recommended by the American Academy of Pediatrics and the World Health Organization for everyone to get the vitamin A supplements. However, I do want to reiterate that vitamin A is not a cure for measles, regardless what anyone says. Even if they're the Secretary of the U.S. Health and Human Services Agency, vitamin A does not cure measles. Cod liver oil does not cure measles. Azithromycin, clarithromycin, and other antibiotics do not treat measles. They can be used to treat and cure secondary bacterial infections. Budesonide, which is a steroid, is not a treatment or cure for measles. Steroids should not be given to people with measles, especially early in the disease course, as it can interfere with your immune system, potentially making it worse. All of these so-called treatments for measles that have been supported by HHSA Secretary Robert F. Kennedy Jr. are not cures for measles. The only cure for measles is time and your immune system. Additionally, none of these can help prevent the spread of the virus. But what can? We'll get into that after I see if there are any other questions. And after I look up that question about the survival of a fetus infected with measles. Let's see. Survive. If I can spell survival. With measles. Let's see. This looks like a promising article, so let's see what this says. I'll put it up on screen. This is maternal, fetal, and neonatal outcomes associated with measles during pregnancy in Namibia from 2009 to 2010. Let's see. So they looked at pregnant women with measles who were matched with 3 pregnant women without measles, which is a great way to do it. This really helps eliminate any biases or any confounding factors. This looks like it might be a pretty good study. But let's see. So here it shows some of the complications and symptoms that they had. Um, of the 55 women with measles who were pregnant, 53 were hospitalized, probably mostly due to being pregnant. 6% had diarrhea, 40% pneumonia, and 5% had encephalitis. That's quite high. But let's see. 42 had known pregnancy outcomes. 25 had adverse maternal, child, or fetal outcomes, and 5 women died of the 53. Let's see. So looks like the measles increased the risk by for low birth weight by a factor of 3.5. Spontaneous abortion was increased by almost a factor of 6 times, and intrauterine fetal death was increased by almost 9 times. Maternal death was increased by almost 10 times the risk. So obviously it's pretty bad, which is why when people who are pregnant are not vaccinated for measles, it is highly recommended that the mother get vaccinated to prevent some of these, because apparently it is quite severe, quite horrible. Yeah, that's a good question. Thank you for asking. I didn't look that up, and yeah, that's not pleasant. Are there any other questions at this point about measles or about treatment or about, I guess we'll get into prevention soon, so hold off on your questions for that. But any other measles questions at this point before we move on? I'll get some water. And we'll go ahead and turn that off. All right, well, I'm not seeing any additional questions at this point, but again, if you have any questions at any point, feel free to put them in the chat. And let's go ahead and move on. Let me get back to the slideshow. So, what prevents the spread of measles? We'll start with how to prevent the spreading the virus if you do end up with measles. If you think you or your family member has measles, call your healthcare provider immediately. Isolate. Stay home from work or school if you have it. If your child is sick, keep them home from school or nursery. If you have to leave, like to go to the doctor, wear an N95 mask. Wash your hands and use hand sanitizer frequently. Touch as few surfaces as possible, and follow the directions from your doctor. You should isolate from 4 days before the rash appears until at least 4 days after the rash appears, but ask your doctor when it's okay for you to end your isolation. Measles is known as measles is what is known as a vaccine preventable disease. The most effective way to prevent the spread of measles is the vaccine. So vaccinate, vaccinate, vaccinate. There are currently 2 types of measles vaccines. One is a combination of the measles vaccine, the mumps vaccine, and the rubella vaccine, commonly known as the MMR vaccine. In the US, there are 2 different MMR vaccines, the MMR2 and Prioryx. The other vaccine adds the varicella or chickenpox vaccine and is called the MMRV vaccine. I'll say this now and likely several more times in the minutes to come, but these vaccines are safe and they are effective. These vaccines do not cause autism. Regardless which vaccine you have available or that you have received, the WHO recommends that all children receive 2 doses of the vaccine. Recommendations on when exactly these 2 doses should be given varies depending on the prevalence of measles in that country and the specific government recommendations. The WHO recommends that children in countries with ongoing transmission and where there is a high risk of measles mortality receive the first dose at the age of 19 months and the second dose between the age of 15 and 18 months, with a minimum of 1 month between doses. The U.S. Centers for Disease Control and Prevention recommends the first MMR dose be given at the age of 12 to 15 months, and the second dose be given at the age of 4 to 6 years of age, with a minimum of 28 days between doses. The MMRV vaccine recommendations are pretty much the same, except 3 months between doses is recommended. If you have not received the vaccine and become exposed to measles, it is recommended that you get the vaccine within 72 hours. This can provide some protection or result in a milder case. I will go into greater details about the vaccine, the history of it, its safety and effectiveness, as well as the growing anti-vax movement and the vaccines cause autism pseudoscience in the next episode. I won't get into any of that today, other than to say once again that vaccines don't cause autism. The vaccine is safe and it is effective. I recommend that anyone who doesn't have the vaccine talk to your physician about getting the vaccine as soon as possible. Vaccines save lives. The main takeaway message here is vaccinate, vaccinate, vaccinate. Susan asks, if I wasn't vaccinated, I might think I just had a bad cold or the flu and not isolate until, etc., until too late. That is a possibility. That certainly is a possibility. Yeah. But when the rash appears, that's typically not a common cold or flu thing. So yeah, that's a bit more unusual, but you're right. Do I have resources about the relationship to autism? Yes, I do, quite a few. I don't think I have any of them in the description of this video, because I wasn't really going to go into that, but I will have lots of them for the next video, which will come out in probably about 2 weeks to maybe 3 weeks, sometime in December. There will be lots of resources about that. I'll talk about how it started, how that theory started, and basically how it's been shown to be not true. And I'll have lots of good resources about that. But you'll have to wait a couple of weeks for that to come out. But what is done if a measles case or outbreak is identified? How do epidemiologists respond and investigate these? As with all disease investigations, it begins with identifying if an ill person is a case or not. Hello, Joel Axel. Yep, thanks for joining. Yeah, this is, hopefully this will provide some good information about measles. But yeah, we need to identify if a person has measles or not. To do this, we refer to the case definition, or the clinical and laboratory criteria for saying if a person has the disease or does not. The clinical case definition for measles is a generalized rash lasting 3 days or longer, and a fever of 101 Fahrenheit or 38.3 Celsius or higher, and cough, coryza, or conjunctivitis. Coryza is the inflammation of the nasal mucous membranes, like what you see in a cold, and conjunctivitis is inflammation of the eyes, mucous membrane, like what's seen in pink eye. Laboratory criteria for disease diagnosis is accomplished by any one of the following: a significant rise in measles IgG antibodies by any serologic assay, positive serologic tests for measles IgM antibodies, isolation of the measles virus from a clinical specimen, or detection of measles RNA by polymerase chain reaction. If you have any questions about any of those, I'll be happy to answer them. I'm not going to go into any details about those unless there are questions. Unfortunately, the difficult thing with people who are sick is not all of the symptoms are always there or not always noted in medical records. And sometimes, for various reasons, laboratory tests aren't always performed. To account for that, cases are split into 3 categories: suspect cases, probable cases, and confirmed cases. Are the tests blood tests? I believe most of them are. I believe at least one of them, or at least possibility for one of them, is a urine test. But I believe most are either blood or urine tests. All right, suspect case is a case with a fever illness with a rash that does not meet the criteria for any other illness, aka it isn't chickenpox, it isn't smallpox, it isn't mumps, that sort of thing. Probable case meets the clinical case definition, but does not have a laboratory confirmed test or an epidemiological link to a confirmed case. I'll explain what that means shortly. A confirmed case is one that either has confirmed laboratory tests or meets the clinical case definition and has an epidemiological link to a confirmed case. So, what does it mean to be epidemiologically linked? That's a good question. Thank you for asking. An epidemiologically linked case is one where the patient has or has had contact with one or more persons who has or had the disease and where the transmission of the infective agent, i.e. the virus or bacteria, through its normal mode of transmission is plausible. That's a lot. I'll read through it again, and then we'll go through some examples to hopefully clarify it. An epidemiologically linked case is one where the patient has or has had contact with one or more persons who has or had the disease and where the transmission of the infective agent through its normal mode of transmission is plausible. All right, now what the heck does that mean? So say you have measles. You're infected with measles. If you had a classmate who had measles and you were in the same room as them while they were contagious, you are epidemiologically linked to that person. Or now say you have syphilis. If you had sex with someone who has syphilis, you're epidemiologically linked to that person. I hope that makes sense. It's a little bit of can be a bit of a difficult idea to wrap your head around, but hopefully those examples helped clarify what that means. If there are 3 or more measles cases that are epidemiologically linked, and at least one of them has a laboratory confirmation, that is considered an outbreak in the US. I say in the US because outbreak definitions vary between countries and vary between how prevalent the measles is. But now we've identified a person with measles. What do epidemiologists do next? Once a person that is suspected of having measles is identified, a case investigation is started immediately. The investigation goes through 5 main steps. First, a specimen is obtained for lab testing to confirm the diagnosis. The remaining steps do not wait for the lab results to come back. Since measles spreads so quickly and easily, it is critical to continue the investigation while the results are pending. In the second step, the patient is interviewed and we try to identify the source of their infection. We use a guide to assist with the interview to ensure that all relevant information, including demographics, clinical data, detailed vaccine history, etc., is collected. The patient is asked about contact with known measles cases or people who may have measles symptoms. If they are in the US and likely other measles-free countries, information about international travel is obtained to see if it is likely an internationally imported case or a locally acquired case. We ask if the person was exposed to someone who traveled internationally for the same reason. Third, we try to identify anyone this case may have exposed. This includes everyone. Oh, I should have switched the picture. I'm sorry. There we go. I actually should have probably switched the picture a couple of times, but we'll leave this one up and then we'll get to the next one later. So we're trying to identify anyone this case may have exposed. This includes everyone that they interacted with or shared the same airspace with between 4 days before the rash onset and 4 days after the rash onset. We are particularly interested in any susceptible individuals that may have been exposed. A susceptible person is one that has not been vaccinated, has not received 2 doses of the vaccine, either on or after their first birthday, or if they do not have a documented history of having measles. And now we'll get caught up on the pictures. This one's a little harder to see, a little smaller, but it basically just goes through the case investigation steps that I'm talking about here. In the 4th step, we initiate measles control measures. Any household contacts that are susceptible, that are identified, need to be vaccinated immediately. Vaccination of non-household contacts, for example, schoolmates, may wait until the test results come back, but this is really evaluated on a case-by-case basis. Vaccination of exposed and susceptible people should occur within 72 hours, as this has been shown to decrease the risk of getting the disease. Depending on if exposed people get the vaccine or not, and depending on their work and school setting, they may have to quarantine, and if they do, the time period may differ depending on their situation. During this quarantine period, they should be monitored to see if they develop measles symptoms. In the 5th step, we conduct active surveillance of the area where the case occurred to see if anyone else with measles or measles symptoms can be identified. We do this until at least 2 incubation periods or 42 days have passed after the last reported case. This helps us to ensure that all cases are identified and the outbreak is, in fact, over. Once again, we're really doing all of these steps at the same time and as quickly as possible while we wait for the lab results to come back. Special settings like schools, childcare centers, and healthcare settings have additional investigation and containment measures due to the increased potential for transmission. After 42 days have passed after the last identified case, we call the outbreak and the investigation over. Now, I know I went through a lot there, so I'll stop here to see if there are any questions, and I see that there is a question from Susan. She says, this could wipe out a school. Yes, it could. Absolutely. Is measles most common in unvaccinated children? How prevalent in adults? So that really depends on where you're looking. So in most more developed countries, think like US, Canada, much of Europe, where vaccination has been going on for 60 years, most adults have been vaccinated. So most of the cases occur in unvaccinated children. But in countries that are less developed, that have been doing vaccines for less time or have more difficulty with vaccinations and have lower vaccine coverage, Um, Adults can still get measles, um, but I don't really know the exact prevalence in adults. And I'll actually talk about some numbers coming up here. And the numbers that are out there are not great. Um, what I mean by not great is they're estimates. We don't really know, at least I don't really know, the true number and true prevalence and true incidence of measles cases, um, because reporting in from rural areas and various other things is difficult. But yeah, I do know that in more developed countries, most cases are in unvaccinated children. The large outbreaks, which we'll talk more about um, in the next video, but the large outbreaks that are going on in the US and in Canada right now are in almost exclusively, but definitely mostly in unvaccinated children. So that's a good question. Um, but are there any other additional questions at this point? Any questions about symptoms, about treatments, about prevention, about the case and the outbreak investigation process? Anything else related to measles you want to know about that I haven't covered? As I said, I will cover numbers shortly. Um, yeah, any other questions? Well, I'm not seeing anything at this point. So I guess we'll just move on and yeah, if you have any questions again, feel free to put them in at any time. So to get back to the last question from Susan, finding reliable historical measles numbers is difficult due to cases not being reported to any central database, difficulty in getting case information from remote rural areas, and other related reasons. However, I have found some case and mortality estimates from the US starting in 1912 and globally starting in 2000, which I'll present here. I do want to say that many of the following numbers, especially those from the early to mid 1900s, are likely underestimates due to incomplete reporting. And for the following counts, I have rounded to the nearest thousand just to make it easier for me to say and easier for you to understand. In 1912 and in the years before, it was estimated that there were 6,000 measles deaths each year in the US alone. In 1919, there were 180,000 reported measles cases in the US. This number increased mostly due to increased reporting to 900,000 cases in 1941. The number of reported measles cases in the US stayed above 400,000 every year, with the exception of 5 years, until 1964. Then the number of reported measles cases rapidly dropped. In 1964, there were 458,000 cases. Then 262,000, there we go, in 1965, 204,000 in 1966, 63,000 in 1967, and just 22,000 in 1968. So that's a drop from 458,000 in 1964 to 22,000 4 years later. Based on the reported numbers and other surveillance data, it is suggested that in the decade before 1963, which is when the measles vaccine became available in the US, 3 to 4 million people in the US were infected each year. Not all those cases were obviously reported. Additionally, nearly all children were infected by measles by the time they were 15 years old, before the vaccine came out. Worse than that, every year, 48,000 kids were hospitalized. 1,000 suffered encephalitis, and between 400 to 500 people died from measles each year in the US before the vaccine was available. I have another picture. 1990 was the last year there were over 10,000 cases in the US. From 2000 on, there have been just 3 years with over 500 cases in the US. 667 in 2014, 1,274 in 2019, and 1,828 that have been reported in 2025 as of December 3rd. The United States eliminated measles, meaning there was no sustained measles transmission, and was declared measles-free by the World Health Organization in 2000. However, the ongoing outbreak may end this status if it is not ended by January 2026. The global numbers I could find only date back to about 2000. Let's see. Quick question from Sarah. Are there regions that have higher cases reported of measles? Do you mean globally or do you mean in the US? I'll ask you that question. But while I wait for that, I'll show you this picture. Global. Well, here you go. This picture will answer your question. So the darker, so this data is a little bit older. I think these numbers were from 2018, 2019. I can't remember exactly. I think 2019. So a little bit older, but the most recent map I could find. So the areas with the darker colors are more cases. Lighter colors are fewer cases. So as you can see, Eastern Europe, Southeast Asia, Africa, the Middle East have much higher incidence of cases as opposed to North America and even some areas in South America. So yeah, some areas are doing much worse than others. But the global numbers I could find only date back to 2000. In 2000, there were an estimated 30 million cases and 777,000 deaths in 2000 alone. By 2019, that dropped to just over 10 million cases and a bit over 106,000 deaths. Unfortunately, in 2024, there were more cases than in 2019, with it going up to an estimated 11 million cases. But luckily, the estimated deaths has continued to drop to under 95,000. This is an 88% reduction in measles mortality from 2000 to 2024. While that reduction is great, there are still 300 measles-related deaths every day, or about 12 every hour. So there have been about 12 people who have died from measles since I started this stream. This decrease in cases and mortality is due completely to the use of the vaccine. It is estimated that the vaccine has saved 94 million lives since 1976. The WHO declared the entire region of the Americas measles-free. I put in parentheses, quotations, not because I question it, but just to emphasize it. But the WHO declared the entire region of the Americas measles-free in 2016. Unfortunately, several large outbreaks in recent years have threatened that and now even ended that status. But I'll discuss that more in the next episode. Susan says those numbers should all be zero. Yes, those numbers all should be zero. As I mentioned, measles is a vaccine preventable disease, meaning we can stop this disease. We just need to get more people vaccinated. Are there countries that push against the vaccine? So I don't. It's a good question. I don't really have that information. Obviously, as you mentioned, in the U.S., there are the current administration has less than ideal. Okay, let's put it properly. They've got crappy thoughts on the measles vaccine and vaccines in general. But I don't know if there are really any other countries or governments that push back on the measles vaccine. I know that in other countries there are people that push back against the measles vaccine. I know one in particular is in Canada, where there is a very, very large ongoing measles outbreak. I'll talk a lot more about this in the next episode, but last I heard a couple weeks ago, there were over 5,000 measles cases in this outbreak in Canada, and it's been going on for over a year. And that is what has threatened and actually ended the measles-free status in the Americas. But again, I'll talk more about all that next episode. And I'll do more research about people who are pushing back against the measles vaccine for that episode. So I will be able to answer that better in the next one. I expect money prevents vaccinations in lower income countries. Yes. Money and infrastructure, and yeah, that is a lot of it. Just getting the vaccine to the people in rural areas can be difficult, and it's expensive, and yeah, there are a lot of issues, but there are a lot of really good people in the WHO and CDC and African CDC and various other organizations that are doing a lot of great work to try to help get all these people vaccinated. But there have been a lot of issues. I will talk more about that next episode. So, how worried do we need to be about measles? That's a bit of a difficult and complicated question to answer. But the easy answer, or easy part of that answer, is if you have the vaccine, you don't need to worry about it. You're good. The vaccine is very good at preventing you from catching measles. If you or your child don't have the vaccine, vaccinate, vaccinate, vaccinate. I suggest that you talk with your physician about getting it. It will protect you. Unfortunately, there is still a lot of measles around in the world. Even in more developed countries that had previously eliminated measles, there have been and currently are very large outbreaks affecting hundreds or thousands of people. In the next episode, I will talk more about this and what is going on in the world of measles and why it is happening the way it is. But with that, I will stop and answer any questions that you may have. If you were vaccinated in 1965, do you need a booster? That is a great question. I didn't talk about it, but I did see, let's see if I can find it again. I did see a website that talked about who needs the vaccine. So let's see if I can find that again. Let's see. Um, Let's see, is this... Okay, found something. So let's go through this. So these are the CDC recommendations for measles vaccines for non-pregnant people aged 19 or older. If you were born before 1957 and have received the 2 doses of the vaccine or have had measles, you're good. You don't need it. If the vaccine history is unknown or you've received no doses, you need to get vaccinated. You need both doses of the vaccine. If you were born after 1957, if you are not in any of these special populations, healthcare provider, an international traveler, etc., we'll start with no. If you are not one of those people and were born after 1957, and you have documentation of either receiving 1 dose of the measles-containing vaccine or have laboratory evidence of measles, or just you have had measles, if you have either of those, you're good. If you've received 1 dose, you're fine. If you're 19 or older. If you have not received it or don't have documentation of it, yeah, you should receive it. Absolutely. So yeah, good question. But no, you should be fine. You've received the vaccine, you're good. You're good. No need for the booster shot. No need for a booster. Any other questions about measles at this point? Again, as I said, I'll go more into the vaccine argument and information about the vaccine and information about the current status of measles more in the next episode. So if you have any questions about that, go ahead and put them in so I'll know what I need to research more for next episode to answer those questions. If you have any other questions about measles, about things that I have covered, go ahead and ask, and I'll try to answer those questions for you now as well. All right, well, I'm not seeing any additional questions at this point. We'll get another minute or so just to make sure. Susan says, thank you. The biologist in me turns on with this information. I know. I get it. I get that. I love this stuff. This fascinates me. It's so interesting. So interesting. Well, I'm not seeing any additional questions. So I want to thank you all for joining me today. If there are any questions that I have not answered yet, please leave them in the comments. Keep your eyes out for the next video where we will be discussing the measles vaccine and the current status of measles. Be sure to subscribe here on YouTube and follow me on Bluesky and Instagram, where I share lots of disease and public health information and news between episodes. You can find the link to those in the description. Stay healthy, stay happy, and remember, public health is for the good of everybody. I'll see you next time. Bye.